Have you noticed any discrepancies between like how the PCPCM model has been advertised to physicians versus the reality of the implementation of it when it comes to a physician switching over? Like, have there been significant discrepancies or missed numbers that were put through the estimates for that initial calculator of should I switch over, or how many of my patients I think are going to qualify? Like, is the boots on the ground reality matching up with what physicians were expecting for the most part?
Yes and no. I find the boots on the ground reality is they didn't realize how much extra work would go into it. That has been one. How much extra maneuvering in your EMR would be needed, how
Mm-hmm.
much extra setup. I did find with a few of my clients, we did some what I would call day in the life real assessments. The AMA calculator for, the suggested calculator for looking at to see if it's a good program for you as a family physician, they didn't find as useful. They found it was an okay tool, but it gave you a possible in the future, this is what it would look like. Where a few
Mm-hmm.
of my clients were like, I want to look at the real hard data. So what we did is we took a week of their previous builds that already been paid through Alberta Healthcare patient encounters, and we transitioned it. We took off all the modifier amounts to it. We put everything back down to the GP base rate. We reduced it to the 68.5%. We removed anything that would have been out of basket or not qualified. And then we looked at that calculation of what it would have been for their fee for service. We did a rough estimate of how many hours they would have worked throughout that week, going by like what the standard research shows. And then the only thing we didn't put into it was the accumulation of the panel payments, because that, again, we didn't quite know where that would sit at until the first one started coming out. And we found that gave a more of a kind of real life estimate that was a little more accurate to what they're actually seeing that they're getting now than where we found with using the AMA one. It did give us a little bit more of an overestimate that wasn't actually reflecting right back to what they were actually billing in their clinic that day. And some of the input lines, we weren't able to adjust them to kind of reflect the specifics of a certain doctor's practice. They were more generic, so we did more of that day in your life to get a real hard look at that, because they wanted to see the hard data of something that had already happened, not the idea of what could happen in the future.
How close did they match up? Like, was it reasonably accurate or was it quite far off in some of those cases?
A few, I'd say anywhere from $2,000 to $5,000 in difference.
Okay,
So
that
not a
sounds like a
great
lot.
deal. Not a great deal when you're doing an estimation, because even when we were doing the live data, it was an estimation. But they were about anywhere from like $2,000 to $5,000 off for the course of what they thought they'd make over the span of a year. So, but some of my docs are
Okay.
very much about, they like the hard, fast, real numbers. So
God, so I thought you meant for that 1 week. I was like, holy smokes, that's quite
no,
a
no,
margin of error.
no.
Okay,
And then of
okay. So
course
it
all
was
the
fairly close.
yes. And then all the estimates that we did of a day in the life didn't include the panel payment, which was also kind of a bonus too, because a lot of the docs, when they looked at their assessment, were like, "Oh, I like that." And then it was nice to be able to say to them, "Yes, and then you get your panel payment too." So then they were like, "Oh, wow." So it was quite interesting that way for them.